Good evening and welcome to the Executive Scrutiny Part 2 to look at the budget. A few ground rules before we start. It will be a fairly lengthy meeting as it was last night, but I predicted 2 hours and I managed to get it down to 1 hour 59, so a minute either way I'm not really fussed with, so hopefully it'll be a minute either way or maybe half an hour south rather than north tonight. But joking apart, I wanted a full, open debate as possible because we need to cover all the issues. I don't want any one particular individual or party dominating the questions, so I want a range of inputs from everybody who is here tonight, if they can please, and we will proceed on that basis if we can. Give people a couple of bites of the cherry. If anybody strays a little bit much, I may need to remind them, but it went well last night, most people indicated, so here we go. Tonight we'll be looking at people services in terms of the children, young people, skills, and then adults, health and housing, and then the part 2 of that will be the capital budget. So we have the 2 cabinet members, Roy and Yvonne, with us this evening. So, Yvonne will be making her way shortly, I guess. Oh, sorry, Yvonne. Sorry, I was looking to my right. Yeah. Well, I was looking towards my right, but I saw you've moved left, Yvonne. Okay. Simon, do you want to do your usual PA, your compare 3 minutes introduction? Yes, please. Thank you, Simon. And then I'll hand over to Yvonne first of all, and then Roy, and then subsequent questions as we go. Thank you.
Okay. Thank you, Chair. So this is the second part of the adjourned executive scrutiny to look at the budget for 23-24. Just to remind members that in setting the budget this year, we've had the... In setting the budget this year, we've had to set it against a context of fiscal events nationally, which has led to both pay inflation, energy inflation, and contract inflation. All of those has meant that there has been a significant shift in the pressures being experienced by local government nationally and locally. And in just setting the scene for tonight, it's we have seen increasing costs, especially in purchasing care from the private sector. We've seen increases in the national living wage, which obviously has an impact on services that we procure. And we've also seen, where we are a direct provider, increases in operating costs. So, as I mentioned last night, we're focusing on the savings, but it's important that you understand that there has been net investment into the areas of social care and net investments into the area of children and young people. And I'm sure the portfolio holder and the strategic director and the directors within Peoples will be explaining and talking you through any queries that you might have. The second part of tonight is about the capital programme. The capital programme is obviously translating some of the assets that the city requires. That they could be existing assets, highways or own buildings, or new developments to support the ambition and regeneration of the city. And they are included in the capital programme. The report that went in December included the totality of the capital programme and the funding sources. If we were to look at it in totality, this is a year of consolidation on the capital programme against a backdrop of significant increases in supply chain costs and everything else. But we'll take questions on that probably on a requested basis as we go through. If you want more details on any scheme, we will try and provide that. So with that, Chair, myself and Alison and John Smale, the portfolio holder, who's here tonight, we will try and answer queries as you require during the course of the evening. Thank you, Chair.
Thank you very much, Simon. Right, for the first part, we can go over to Councillor Williams, Yvonne, if you want to talk to the meeting, please. Thank you.
Thank you very much, Chair, and may I just say thank you very much for the invite tonight, much appreciated. I sit before you tonight, not in a place that I would want to be, because let's face facts, this is probably the hardest budget that I've ever had to do in my 23 years, 11 of which have been as a cabinet member. This is by far the most difficult budget that we've had to see. Am I happy in presenting a budget to you? Of course not. But we are in a position that we are in, and there's a number of reasons behind that, which I want to quickly take you through before I outline some of those savings. So we know that there have been pressures because there have been demands in the system that are increasing. There have been changes to legislation that hasn't necessarily had the right amount of funding to it. We also know that we have seen some new emerging issues as we've come out of the pandemic, with an overall increase in the numbers of children that require safeguarding activities. So there have been a lot of different things going on. We know that the market, the care market for children is very difficult at this moment in time. But in doing that, what we've had to do in children's services is to have a look at what we are doing and what we are protecting. We have to understand that as the increased number of children come through care, that we make sure that they are safe and protected. And that means making sure that the social workers and the differently qualified workers that we have are also protected. And I think you will see that very much so in this budget here. We definitely have got forecasting pressures in terms of our send issues, and we also have pressures coming forward in terms of the UAS children that we look after. So there are a number of different issues that have come forward. What we have spent time doing over the last couple of years is having a look at how we can do things differently, having a look at how we can actually be very proactive on a strength-based model. And I'll give an example of that in terms of our Staying Together team in children's services that have been very successful in working with our families to try and prevent children coming into care. So the proposals that you've got in front of you, I did not propose to go line by line, but I'm happy to take any questions there. But what we've tried to do is have a look at where we can have reductions in headcount, particularly if we can get voluntary redundancy posts there where there are vacancies. So you'll see that running through the paperwork that you've got in front of you. We try to prioritise our frontline work so that you won't see much change to the work there, but there will be changes. I'm not going to sit here and say it's all going to be hunky-dory, because we know that it may not be. But what I can give you assurances of is that the staff in children's services across the board are so innovative in the work that they do and the way that they do their work. They have prioritised the protecting children, and they have done some outstanding work. In fact, I might say that they are outstanding. As you recently know, they have been Ofsteded and they judged by Ofsted as outstanding. So I want to pay tribute to the teams across children's services because when they get challenged, and we have had a large number of challenges over the year, particularly from our colleagues in finance who have helped us to have boards where we have looked at what could possibly be done differently, how we can make savings, how we can improve the services for our children and young people across the city. They have risen to the challenge across the whole system. So without that work, we would be having a much tougher time here tonight, so I want to say thank you. But in terms of moving forward, you'll have the proposals in front of you. I'm happy to take any questions on them, but to say that without that preventative work during this year, there would be a much greater problem. Thank you, Chair.
Thank you, Yvonne. I'll bring members in shortly. One concern that I have, and I know other people have raised it as well, is the reliance on out-of-area placements, which are costly and disruptive in many cases for individuals and their families. And we need to thoroughly explore every opportunity to bring back into the area these placements, either on our own or in the N2-D2 partnership. A, it's the right thing to do, and B, it's financially the right thing to do. So could you give us your views on that, please, Yvonne, before I bring my colleagues in?
Where we can safely, my voice is a lot louder on that, where we can safely bring children back in, whether that's from residential care or from school placements back into the city, we can and are doing that. But again, I must emphasise it's got to be safely. And we've got to make sure that the placement is actually right for the child. So there might be, for example, a case where you have a child that is in an external placement outside of the city, but that might be the right placement for them, and to move them for the sake of moving them is not the right thing to do. So every single child is looked at individually, but that work is absolutely ongoing. And I can give you those assurances that that will continue to be ongoing.
Okay, thank you. I'll take members. John. Thank you.
Yeah, thank you, Chair. I agree that CYP staff are, on balance, extremely good. The staff are clearly doing a fantastic job, but there's only so far, that they can be stretched before the whole thing snaps. Just want to mention 3 areas that are being cut, if that's okay. The first one is the deletion of the exiting care team, leaving care. It was in my day. I believe that it's a statutory function. I'm sure it used to be. I'm sure Ofsted used to report on it. So I don't know how we're going to get round that in the future. On the same line as the exiting care team deletion is the fostering allowances and declaration of interest, etc., and all that sort of stuff. Last year there was a 1% increase in fees, and this year there's no percent. There hasn't, I'm pretty sure there's been no increase at all since you brought in the payment for skills. So the actual foster carers payment has been frozen now for, is it 3-4 years? Just at a time when, of course, one of the few ways we can actually save some money is by attracting foster carers. I appreciate that's not easy, and we've been trying to do it forever. But the last thing we're going to do, last thing we should do to attract new foster carers is just pay them a lot less. So that's a bit of a, I don't know whether that's a real own goal. It seems like it to me. And the third thing I just want to ask about is line 32, which is a reduction in the school improvement team. I mean, it's incredibly depressing, this is, and to me it just seems like a self-fulfilling prophecy. We reduce the school improvement capacity, and schools probably think, okay, well, we'll take the hit and we'll become an academy. Is that the natural sort of outcome of that one? Thank you.
Thank you, John. So we've got your first point, John's first point, the fostering allowance, and then the school improvement team reduction. Yvonne.
So I think the first one was exiting care, and to say that any statutory functions will be continuing there, but it will be with the social workers in the actual teams. So that won't stop. Yes, if I can make the savings between now and the budget going out, definitely the exiting care team would be one that I would be looking at there. But any statutory functions will be existing and will be carried out by the social work team. In terms of the fostering care allowances, Again, this is one that I would definitely want to increase, but I just want to set the I just want to let you know that actually for our foster carers, we actually do pay the most in the East Midlands, which I'm very proud of. We do have the payment for skills work, which is absolutely phenomenal in terms of that professional training and standards there. So, and again, this is one that I have asked the team that if they can make those any savings, that this is something that we can look at again. So I would agree with you, John, there. But in terms of in the actual East Midlands area, we do have the best payment allowances going. In terms of the school improvement team, the number of schools that are LA maintained schools have obviously drastically reduced. I don't believe there is any intention from any of the political parties to reverse the Academies Bill. I may be wrong there. But if there are those intentions, then obviously moving forward, that would be something that the council would have to look at in terms of the school improvement team, because actually those schools that are now in academies, it is their responsibility for their school improvement, their SIOs, etc. So that team have done some really phenomenal work and have worked really closely both with the LA schools that we have, which you're right, the numbers have diminished over the last couple of years. However, as I said, I don't think there is any political party that are going to repeal that law, and therefore I think the direction of travel will be those LA maintained schools probably will at some point in the future be academising. And as the numbers reduce, so too does the call on that team. So I think in terms of what we could have done in terms of making cuts and savings, I think this one is one that we've had to bite the bullet on, really. So I understand your frustrations there, but there are a lot of places that schools can go, and a lot of places schools do actually buy in that help and support from other areas rather than the LA.
Thank you, Yvonne. Paul.
Good evening, Yvonne. I'm looking at, on page 33, remove the 3 full-time equivalent vacancies for the children's practitioner posts in early help. I suppose that's an easy scalpel to wield because you're not actually making anyone redundant, you're just not recruiting. But I would argue that any work in early help, and the more bodies the better to do it, is essential to forestall or mitigate a child's support needs and seriously risks costly and protracted interventions later in childhood or young adulthood, the costs of which cumulatively could be eye-watering. Aren't we kicking the can down the road by not replacing or filling those vacancies?
Thank you, Paul. Yvonne?
Thank you. I absolutely understand your argument there, but what I will say is that the early help team, when they have been having to look at different ways of working, have been really innovative in the ways that they are working. And actually, again, I'm going to pull out that Staying Together team who really formed around sort of budgetary need and have been phenomenal in their outcomes in keeping families together and keeping children from coming into care. And again, those teams are very good at doing what they do best. So yes, it's going to be hard. Yes, there will be probably a reduced number of children and families that we will be working with, but it will be very much more targeted. But again, those teams are great at being very innovative about the way they work, but also working with our partners across the board as well.
Thank you, Yvonne. Mike.
Thank you, Chair. Good evening, Yvonne. The 2 items on home to school transport, which amounts to savings of almost £500,000, they're not in existence yet, and I think there's going to be howls of anguish over that. I've already heard and some people email me about it. What confidence do you have that you can achieve savings of £433,000. Thank you, Chair.
Thank you, Mike. Yvonne.
So again, it's an area that we're out to consultation on at the moment, separately to the budget consultation as well. It's a very tricky area. Over the sort of last decade, there've been a number of opportunities that have been really missed, really, where this area could be looked at, because it is a sensitive area. It is a very emotive area to look at. But I do believe that there is work that can be done with our families and with the teams. And I'm hopeful that we will be able to make those savings, because at the end of the day, if we don't make those savings, then they do come off the budgets and they will have to be taken from elsewhere. So there is, it has to be done with sensitivity. And I'm confident that the team doing it have got those required skills. Thank you.
Thank you, Yvonne. Can I ask a general question? In terms of the social work vacancy level, demands for the service, and the size of caseloads and complexity, where are we with regard to all those? So vacancy levels, demand for services, caseload of each worker approx, and complexity. Are we quite comfortable about where we're at the present time with the reductions that we're making?
So, yeah, I mean, I should have brought my assured safeguarding documents with me, which have all of those details on them precisely. What I would say is in terms of our recruitment for social workers, it is ongoing. We could keep an open recruitment going. We are probably at the lowest that we have been for a very long time in terms of agency numbers. I think it's probably the lowest we've ever been. And we're in single figures there, I believe. 5, there you go, 5. So that's gone down from my last briefing. So a lot of work is going on there to make sure we're doing that. We're also very mindful of what's going on across the D2N2 partnership, and we've been doing a lot of work with our partners across the work there to make sure we have things like memos of understanding, that we're not upping the different costs and salaries, etc., and outsourcing, making others not want to come here, or vice versa. So there is a lot of work going on across the region to help each other and to make sure that we keep them there. In terms of our caseloads, again, I'll refer you back to the Ofsted report there. It's all in there. But again, we keep monitoring it. I have a monthly meeting with the Director of People Services, with the CEO, with the safeguarding team, and with the independent chair of Derby and Derbyshire Safeguarding Children's Partnership. And we monitor that absolutely, on top of monitoring that to make sure that any changes, that we have a look at what needs to be done, and we keep that very focused. And that's been an absolute driver in terms of that. So the recruitment will be ongoing. As far as I'm concerned, we will keep that as an open recruitment, and people do want to come and work here in Derby because we are outstanding and we are innovative, and we do things differently. And I said do, so I apologise. But, you know, we're working very hard on that. So I have to say, I'm extremely pleased with the work that's gone on there, and in terms of where we are regionally and even nationally. Derby is a fantastic place to come and work for social workers, and I'm really proud of that.
Thank you, Yvonne. Nobody else has indicated that they wish to speak. Oh, sorry. Yeah.
Yeah, sorry, thank you. Yeah, I'd like to ask, a lot of the reasons why children and young people go out of area is because there isn't appropriate provision locally. Now, in terms of out of area placements and the pressures, the occurring pressures that result from that, I'd like to know what's being done to identify those gaps in provision, ensure that we do have that appropriate provision locally, particularly when it comes to children, young people with autism and social, emotional and mental health needs. So I'd like to know from the Cabinet member, please, what is being done in that respect. Thank you.
Yvonne?
Oh, there's an absolute plethora of work going on in that, as I'm sure you all know from the work that's gone on in the last couple of years. But an example that I will give of the work there in terms of making sure that we have got more places within Derby City. We've worked very closely with St Giles. And we have converted the Hive, which initially gave us 60 more places for children in Derby. We're also doing some other work with across the partnership. As you all know, SEND is not just the City Council, it is a local area partnership. And we're doing work with health, with education, with the schools, and we've got the capital programme coming forward. Again, we're working together much better than we have ever done in the past. And yes, there are improvements still to be made, absolutely. As you know, you've been having a look at it on Scrutiny, and you've been kept fully informed of all the work that's been going on, and we'll continue to keep doing that. And again, it's being led by data and driven by information, which we have made some absolute changes to in terms of gathering that evidence, gathering that detail, and being led by data-driven information. Thank you.
Thank you, Yvonne. I think Lucy indicated she wished to speak, and Nicola, thank you.
Thanks, Yvonne. It's clearly a really challenging area at the moment, and it's challenging. But it's not just a challenge for us as well. I was wondering, there's a line here talking about the funding of disabled children going to Lighthouse and amending the funding split with health to 50-50 from 60-40. Is this something that health are able to accept? Has that been negotiated? You know, are they willing to take that on because their budgets are as tight as ours?
Yes.
Go on. Yep.
Yes is the answer to that.
Yep. Okay. Right, thank you. Nicola.
Thank you, Chair. Obviously, it is really good to see how open and honest and transparent we continue to be in terms of the home to school transport, because within the pressures, it does show that we're actually putting £6.5 million into that, as well as some of the savings that have to be achieved. I presume that is just purely down to the demand pressures in terms of numbers, and obviously the offset of the post-16 and other savings that you're looking at, but the pressures within there of the £6.5 million. Could you explain that a little bit more to us?
Yvonne?
Yeah. So in terms of the pressures moving forward, obviously, again, consultation at the moment, but it is something that we have to relook at. And if I'm being honest, we're probably behind other authorities who've already done this. But again, it's about having those conversations with parents, with schools, moving forward about how young people can, if they're able to do things differently. So that is an ongoing piece of work.
Surely that's going to impact on the service.
Yes, it will impact on the service, and I'm not going to try and fudge that. However, I think what we've had to do is have a look at, you may or may not know, but a lot of children's services are statutory services. That means we have to do them. We don't get a choice over that. We do have some room to manoeuvre in terms of how we do that. But with early help, what we've tried to do here, if you have a look in the posts, is where we do have vacant posts, is to remove them. So yes, it will have an impact because, you know, if we had the funding to keep them open and we were able to recruit to them, then obviously we would. But what we've tried to do is to have as little impact as possible here. So again, it was trying to be a bit more sensible about how we've done this rather than just, you know, taking out whole teams. We have very much looked at where we can match vacant posts. We've tried to, but most of the early help that we have is not statutory, whereas a lot of the other services within children's portfolio are statutory.
Would you agree, though, Yvonne, that preventative work is sometimes some of the most valuable work? And could this not, with all these posts being deleted in early help, couldn't that lead to more children coming into care, which is not necessarily good for them, the families, and the costs involved?
So again, I'm going to ask you, obviously, if I had the money, I would definitely keep early help posts in there. But again, I'm going to remind you about how the teams have changed and looked at the way they're working and using different models of working. And again, it's making sure that we are targeting those families that need the targeted help as much as possible. So there will be less of a universal approach. And yes, potentially that could have an effect. That's a logical statement, isn't it? But where there is limited money and you have to make savings, we've tried to do it in the way that would have the least possible negative impact on the service that we can do. Will it have an impact? Yes, it will. Thank you, Yvonne.
Paul?
Yvonne, it might not involve you directly. I'm just seeking reassurance that if you cast your mind back to last year's discussion in full council of the budget, Councillor Martin and I proposed an amendment which saved two areas from savings. One of them related to NEETs and work with NEETs, people who are not in education, employment or training after the age of 18. And there was one other area that I can't put my finger on. That was carried as an amendment by full council. I haven't seen it anywhere in the savings this year, but have they been left untouched, those two areas that I refer to, in terms of savings?
Yvonne? So, thank you, Chair, sorry. So the other area that you talked about was the area where it comes to our youth workers. And so what we have done, as you have both been briefed in the past, is that we have an alliance model here in Derby, and we are working with the Youth Alliance, who do provide some fantastic youth services and youth modelling for us here in the city, and we continue to be working with the alliance model moving forward. Thank you.
Thank you, Yvonne. Alison?
Thank you, Yvonne. That is a disappointment. The amendment to full council just shows this administration's continuing disregard for motions in full council, which we did discuss in the constitutional review with the guy who came along to talk to us about this, about the constitutional role that full council makes, because the amendment to full council stated very clearly that money should stay within the council. And actually, I specifically rejected a suggestion from a senior officer that the money in the amendment go to an external body, the Youth Alliance. So that was explicitly not the motion that was put forward to full council, and it was not what was passed at full council. So it is disappointing to hear that will of full council has been ignored yet again. Thank you, Chair.
Thank you, Alison. Yvonne?
Thank you very much, Chair. What I would suggest is if you wish to be explicit in your emotions, that you are absolutely explicit in your motions, because we have done what was said in the motions, and we continue to have youth services provided within the city. It is just not being provided wholly and solely by the city council. Now, Moving forward, what we tried to do is to have a look at the providers out there who could provide youth services in the city, who could do it most effectively and to reach the most young people that we have. And that was not being paternalistic. That was having a look at our partners across the city of who could do that and who could do that perhaps better and more effectively than we could. How many more children would benefit from it than it being held within the City Council service? And I think that we have done that very effectively with our partners. And again, sometimes you have to be really honest about whether the City Council are the right providers. And if we aren't the right providers, being brave enough to have those conversations with others who can provide services at a much better, more effective rate. And I always ask myself the question, so what? If we were to have kept those 2 posts within the City Council as youth worker posts, would that have meant that more children were able to engage in open access youth services than they would do with going with the Youth Alliance? And I ask that question all the time. So what? What's the difference? And actually the difference here has been that we have been able to reach more young people, that we've been able to engage more services across the Youth Alliance provider system. And I think personally that is more effective. If you are ever in my position as a cabinet member, you will have those options and that will be up to you. But that is the way I decided to interpret that motion, and I have made sure that there are youth facilities and youth engagement and work going on with young people across this city, just not by the City Council doing it.
Let Alison come back quickly on that. I know Lucy's been waiting patiently as well.
I don't think this is the moment to sort of look again at that whole detailed issue. I'm grateful for it being raised, but actually I do think for the record it's worth saying the motion was extremely explicit. I explicitly rejected a motion that suggested the course of action which you've obviously taken. And actually, not only was it explicit in the motion, it was very explicit in what was said by myself and Councillor Hazelgrave in full council. So if only people would listen, as I say, this business of what role full council plays in actually of motions, etc., whether they're actually listened to or not. It's all right talking about working with people and all this sort of language and this comfortable language and doing our best and working differently, etc. But we'd had explicit motion passed and it clearly wasn't followed. And that is unfortunate, but it is something for us all to look at in the constitutional review, I think. Thank you.
This discussion about the wider community role is really helpful, because this is what I was wanting to ask about. And not so much as the general services, but whether there are more opportunities for us to engage in that sort of direction in the more personal support. I know when we've got looked after children coming to us, we see if there are family or friends who might be able to provide support rather than coming straight into being the council. But are there other opportunities? Is that an area we could explore further, or is that already happening?
Thank you.
No, thank you, Lucy. Absolutely. I think what we have discovered, particularly through COVID and the work that we have done with our partners, is there are partners out there who really do want to help with the system and have been fantastic at coming forward with ideas, with solutions, and we'll continue to work with the partners across the partnership network. And that is really vital that we do that. So appreciate that. And of course, in terms of the work with our looked after children, absolutely. Conversations are always had where possible and where safe to do so with families. Thank you, Lucy.
Thank you, Yvonne. Nicola.
Thank you, Chair. I just want to come back on Alison's point. I can totally appreciate from her point of what is it that we as Cabinet, as councillors, as part of full council and proposals and amendments and all the rest of it, what we are entitled to do. And I think you're absolutely right to raise it in terms of constitutionally, what can we and should we be getting involved with? Because ultimately, what we are here to do is to look at making sure that people in Derby are given the best service for their pennies, if you like. And I think it's interesting that we, as councillors, we have to be careful that we realise that we are not the specialist in every subject, that there are officers in this council and external providers that know exactly how to reach and to get to do the support that's necessary. I just think it's important for us to reflect on what is our place as councillors, and should we be dictating to where to spend the money in individual department heads and managerial positions, because otherwise why do we have the managers to make those decisions for us?
Okay, Danielle.
Thank you, Chair. I think a really important question for me is the council expecting an increase in demand for council legal services in response to these cuts to statutory services in CYP? And if so, what is the projection?
Thank you, Danielle. Yvonne?
It depends which part of the service you're talking about. Take, for example, the home to school transport. I would suspect that there would be challenges there. It'd be silly not to expect that. But again, I think it depends on which service you're looking at. So there will always be challenge. I think it's how we build those relationships with our communities and how we work together to try and come up with the solutions.
Thank you, Yvonne. Thank you very much for that. Really appreciate your input. Thank you, members, for questions. Moving on to Roy. Roy, if you could spend about 5 minutes, and then we'll allow the majority of the time for members to ask questions, just to outline your area and some of the issues. Thank you, Roy.
Thank you, Chair. And as you're aware, I deal with adults, health and housing as Cabinet member. And we've seen some changes over the past years with legislation, Care Act 2014 amended in last year, and we're still awaiting the report on the fair cost of care, which we have been waiting for a long time. It's had several iterations, but we are still waiting for that. And that's put social care in the position that we're seeing in this budget. We are a legal provider of statutory services, and we have tried to protect those within this budgetary framework. We do have still some non-statutory work going on, but that is part and parcel of our way to manage demand. I also cover public health, but you won't see anything in this budget that impacts directly on the public health budget, but just to let you know that that is constantly kept under review. We are seeing as a service the pressure increasing. We're seeing increasing demand for services, and without doing anything, budgetary pressures are increasing because of that demand. We are working with partners, and I've got to say particularly with NHS and associated services in trying to work together in partnership to deliver our services, and the new legislation around integrated care boards, integrated care partnerships involving the local authority and health have been a big step forward. We have tried to protect frontline social workers and direct service workers and also encourage social worker retention. I mentioned demand management. You're seeing that through local area coordinators in every ward in the city. You're seeing that through Live Well in trying to help people live healthier lives, and you're seeing that in community support with the community and voluntary sector. Our duty is to provide a safe service, which this budget can deliver. On the housing side, we've got a vibrant new build programme, 4-bedroom plus housing, properties are at the top of the list as a priority, as the waiting lists for those properties are a lot longer than most other properties within our service. Empty homes have been brought back into use. We are still seeing a challenge with right to buy to replace homes one for one. Our statutory duty on homelessness support as a council is dealt with through Derby Homes, and we have seen some really increased joined up work in there with homelessness providers across the city signing up to a working relationship. And when I took over the cabinet post, we had on-street homelessness at 37. We are now down in single figures, so that work is proving successful. We are working with private sector landlords, and you have seen recently the report that the public health team did on some of those landlords not meeting the decent homes standard. So we are taking action to hopefully improve that. And we have been changing tenancy agreements to respond to current need. That's a brief overview.
Thank you, Roy. Roy, it was mentioned last night, half seriously and half tongue-in-cheek, that the problems caused by Liz Truss, who was a 10-year premiership, was outlived by a lettuce in a fridge by 49 days to 48 days, that led to the hyperinflation that's affecting us nationally and now locally. Would you agree, as others said last night, that it has certainly made our situation worse than it is at the present time? That's the first point, so I'll give you some time to ponder on that. One of the major problems that we do face, and that's been growing for a number of years, is the bed blocking in our hospitals and the inability to get people out at the rates that we need to do, because of lack of facilities in the residential sector. And how much of a problem is that, Roy? And what, if anything, can you do about that locally, or in terms of trying to get your colleagues nationally to, at long last, after that 10 years of failure when there was cross-party agreement, to have a cross-party settlement to deal with adult care and health? And that's never been fulfilled as originally agreed 10 years ago, and that's led to the problems that we've had for many years. That's a couple of points. The final point I want to make is on page 32, Roy. We look at 3 or 4 lines halfway down, and that's Home First and Shared Lives. You're proposing to take out £500,000, £512,000. How many posts will this affect, and what effect will that have on the invaluable service that that provides and those vulnerable people and families that actually use those services? Thank you, Roy.
Thank you, Chair. Liz Truss's premiership didn't help the situation. So we've got to move forward from there, and this is our response to all the situations that we are facing. Don't forget, we've had a pandemic which has affected services. We have a war between Russia and Ukraine, which has dramatically affected inflation. So it is not just what's happening in this country that's affecting this budget. It has a lot to do with a global situation. With regards to bed blocking, it's only a couple of years ago, before the pandemic started, that we never had a problem with bed blocking in Derby, and our services were excellent, still are excellent at delivering to the hospital beds where people can be moved to be assessed for care. But those beds are under pressure because there are now more and more people queuing to leave hospital where services are not available to take them. Options are being looked at. We've received some increased government funding this year, so we are looking at options to purchase additional care services, so be that hotel, which I understand has been ruled out, but looking at underused care beds within the city to block book so that people can be discharged from hospital. But don't forget, Derby's problem is only exacerbated by problems across the East Midlands. We have an East Midlands ambulance service that is really struggling at the moment because ambulances are being left at the door of A&E with people in them, and those people cannot get into hospital. So it's not a simple problem. It's not about opening the back door. It's about making sure the front door can deal with those people effectively. Do you want the answer about? Yeah, if you want me to respond to that, you asked about the number of people that affects. That affects 0.8 of a full-time equivalent, and that should not, and I repeat, that should not adversely affect the service. It will have an effect, but not an adverse effect with regard to shared lives. Don't forget, this is similar to foster care for children, so this is older people that really need that support, and we are reliant on those people to volunteer in the same way as foster carers.
Thank you, Chair, and thank you, Roy. Roy, I think we do have to look at, you said this was a safe budget. I have some serious concerns, deeply serious concerns about aspects of it. We have to face the reality that the health and social care system in Derby and Derbyshire, because it's integrated now, but is in a crisis. I mean, we cannot sit here saying we're working with people, we're bringing in partners, we're working together. We need to face the fact that it's in crisis. A critical incident was declared on New Year's Eve, and that was only revoked 13 days later. So it's only just been revoked, and the situation is still in crisis. People in the city are afraid because the ambulances are blocked. I've seen them myself, 14 ambulances waiting outside of A&E because they can't remove people from the hospital. This is an absolute crisis. People are afraid. They are afraid because the ambulance services are not able to reach people in anything like the target that they should be making. And we keep seeing reports of, to be honest, I don't want to be alarmist, but there have been reports in the paper about people dying. I do not want to be alarmist, but we cannot sit here and not recognise the nature of the problem we've got. And it does come down to this budget. I'm sorry. 10 days ago, I wrote to the Chief Executive of Joined Up Care Derbyshire, and I expressed to him on behalf of the city, as the chair of the Adults and Health Scrutiny Board, people's concerns and their fears about their health and their safety in the current NHS crisis. And as it so happens, I've had a response from Chris Clayton, the chair, the Chief Executive Officer, this afternoon. And he is talking about this blockage in the hospitals. And he does say the primary challenge is to ensure we have the available workforce in our community nursing, community occupational therapy and physiotherapy and domiciliary care services to create the package of care at the right scale and in the right directions. The competing workforce factors, especially for the home care market, are especially acute during the winter and Christmas periods. Now, there is a real need for more support. In order to unblock this system that is making people afraid, we have to do everything we can as a council to improve that domiciliary care and to improve the home first care system. And yet I see that you are proposing, budget cuts. Budget cuts. I'm literally perturbed. I mean, I'm very perturbed by this. We've got £190,000 being taken from it because it's got no commitments from it. And yet, one of the things Chris Clayton also says in his measures is that we need to incentive payments to support the retention of domiciliary care staff in local authorities. So I understand the big pressures that everybody's under. Everybody knows this is a very difficult budget, Roy, and that it's difficult to find savings. But I put it to you, at the moment, this is not about geopolitics. This is not about, what's happening in Northampton. This is Derby now. People afraid, people dying, and we do need to be doing more for social care. And I am very, very worried about it, as is the CEO of Joined Up Care Derbyshire. So please, can you explain why that money is coming out of these posts, and one of them in home first occupational therapy, and then the other reductions, which amount to hundreds of thousands of pounds? Thank you.
Thank you, Alison. Roy, if you can try just in a few minutes, because I've got a list of people wanting to come in, so yeah, just a few minutes. If you can try and respond as fully as you can within a few minutes, I'd be grateful. Thanks, Roy. Okay,
The home first is not a reduction in people. That is uncommitted funding that was for winter pressures that wasn't used. So that is uncommitted funding. I did mention to you that, or to the Exec Scrutiny Committee, that we have had some additional funding for discharge payments for this winter period. That is not covered in this budget, but we do get government funding for that. With regard to any other services, yes, I do understand where you're coming from, Councillor Martin. It's not a situation we want to be in, but we've got to work with what we've got to work with. And I have written in no uncertain terms to the Secretary of State expressing my concern about social care in this city. And I am awaiting a reply to that at the moment. I do not like what I'm doing here, but we have a legal duty to provide a balanced budget, and this is an option that we are looking at. It's out to consultation. It's an option that we're looking at to try and provide services across this city. I can't deal with the hospital issues. I can only deal with getting people from the city of Derby out of those hospitals. There are people from all over this county and other counties that are in that hospital. They are not just Derby patients that are causing a problem.
Good evening, Roy. Just looking at some of the lines on page 32, the Home First reduced capacity of the service by reducing current vacancies. Clearly an easy knife to wield because they're not actual people, they're vacancies. But aren't we, by permanently reducing the ideal staffing levels, jeopardising the good CQC rating for Perth House, and much more important, will it not lengthen patients' stay as their speed of recovery will be impaired, as there will be fewer people to look after them? Also, is there any help from the NHS under integrated care social statutory arrangements to cover the shortfall? And could you also explain the line below for Home First? Although I think you might have explained that, I'll withdraw that. Yeah, I think you explained the winter pressures issue. Also, we also get quite a big amount, nearly actually over £2 million when you count for inflation over 2 years, scaled down care packages for people living in the community. How does this square with reducing health inequalities, a major pillar of the city plan? Will it lead to deterioration in people's conditions, resulting in hospital admission, or at least a further reduction in their quality of life? And the third thing I want to bring up, which is only about £79,000 a year, and it's the one which is withdraw funding for mental health day service that is jointly commissioned with the NHS. Now, on this, is the NHS picking up the 79,000 shortfall, or will mental health day services be accordingly reduced at a time of no doubt acute need, and which one would expect to contribute to avoiding deterioration of users' or patients' problems?
Thank you, Paul. Yeah, and I think if you could respond to all the points that Paul's made, but referring to one of the points that Paul made, it's almost £1 million. Scaled down care packages for people living in the community, £950,000. Would you agree that's imposing rationing, Roy?
It's not easy sitting here trying to defend something that I wouldn't really want to defend. If we were in a situation where we were properly funded, I wouldn't be doing this. But we have got to look at where we can provide a balanced budget for this council, and if you've got anywhere else that you can recommend as executive scrutiny that we can take money out of council services and bring them back into adult social care, I would welcome a conversation on that. In the meantime, I have to try and make sure that we give the best service possible to our residents. On the occupational therapists, it was Councillor Hesselgrave who mentioned those, and those have been vacant posts for some time. If you talk to anybody in health or social care, they will tell you that it's very difficult to recruit occupational therapists. Rather than leave money in a budget that was being not used by, because we can't recruit to those posts, we are proposing that those posts be taken out, and when we're in a position to be able to recruit occupational therapists, we will endeavour to replace them. And I missed the final one, Paul.
It was about the mental health. It's
Yeah. The mental health one, yes, that's a reduction as far as we are concerned as a council, but we are working with the Mental Health Trust to pick up that particular part of the budget so that they will be a major provider of that service.
Thank you, Roy. Mike and then Lucy. And if you can make a note, Roy, I'm going to ask them both to contribute, then you can respond to both Mike and Lucy. I'll do it in twos now. Okay, Mike.
Yes, thank you, Chair. It's quite a simple one. There's a proposal in here to reduce the amount of personal contact by using telecare. Now, I can understand that, but a lot of these people live on their own and are isolated, and taking away visits from people just so that they can press a button if they want somebody is going to increase their sense of isolation. So I'm not happy with that, Chair.
Thank you. There's been quite a lot of talk about the role of the community in service provision here, and I know it's one of the key things which the local area coordinators are doing at the moment, and I very much welcome that. But on the preventative side, you know, I'd love to be able to keep more people healthy more of the time and not have to deal with people who, not have to provide the services for people who have greater needs, because we've kept them healthy. It's a, you know, it's an aim I'm sure we all share. But if we're going to, can we do more to engage the community in that? I know that it is something where there can be direct conflict between the services that we as the council want to support in terms of the sort of leisure services that we talked about yesterday. But some of the exercise classes, for example, for older people, but equivalent things are being done, not provided through our initiatives, but through other people's initiatives. So a whole network of those could be being promoted to people who are still reasonably able at the moment, or who would gain from doing that, but who may not be thinking of accessing that. And it could mean that they remain able to do more for themselves for longer, which reduces our costs. So do we have initiatives to work with the community on that sort of thing?
Thanks, Lucy. Roy, can you come back on both those points by Mike and Lucy, please?
If I can come on Lucy's point first. Lucy, you will have heard of Livewell. You will have heard of Move More Derby. You will have heard of Derby County Community Trust. Those are three of groups of organisations, be they financed or voluntary organisations, that are working with initiatives on healthy communities. And I know our leisure department are working with them, and indeed some of that work is funded through public health. So if we have people coming out of hospital after strokes that need services, or people that have problems with lungs and hearts, then they are referred by consultants through to those services and can get that help and support, not only to keep people that are already healthy in a good condition, but those people that have been discharged from hospital to help bring them back to where they were. So there is a lot of work going on around that. With regard to Councillor Carr's point on telecare, what we're trying to do is to make best use of the technology that we've got. So yes, we'll still provide that human contact, but telecare is an aid to the person concerned, so that in between that human contact, if they have a problem, they can wear a watch with a button on, or they can have the medallion type button to call for services if they need them urgently. There's all sorts of other things they can do, like putting under mattresses if people have a tendency to fall out of bed, if they leave their bed at night to go to the toilet and don't return within a specified amount of time, then that sends an alert, and the telecare service is there to pick up, literally pick up the person in need. So there is a lot of good service with telecare.
Lucy wanted to very quickly come back on one point, so very quick, and then a very quick response from Roy, because I want to bring in the final two speakers, because I want to go onto the capital budget and spend some good time on that.
Thank you, Chair. It's to go one step further, Roy, from what you were saying, in that we have the Live Well scheme, and they have people who are, I believe, self-employed or casual labour to provide those sorts of services. But there are also people who are doing appropriate exercise classes and have the appropriate training, but who are not being publicised to the community. So it's really picking up a whole list of potential services in the same way as you might do for youth services, but for a different demographic.
Roy, quick response, please.
The LACs are coordinating all of that activity-related service, and they refer people as and when they need it. If you self-refer to Live Well, you can in fact be put in contact with these services. So it's not just the three I've mentioned, it's a wider range of service providers.
Thanks, Roy. John and then Hardy, I'll take both questions and respond to them. Thank you.
Thank you very much, Chair. Just going back to the shared lives team, first of all, it is 1.8 FTE that's being reduced, but I suppose actually the question might be for Yvonne as much as anything, but going back to my earlier point about the children's services being stretched to the point of snapping, having to assimilate the shared lives team as well as having to do everything that exiting care team were doing is a massive concern. And is there a resource implication for children's services taking on the shared lives team?
Thank you, John. Hardiel. Could you make a note of that, Roy, and have a think about that?
Thank you, Chair. Thanks, Roy, for your presentation, and I do sympathise with your comments that if we were properly funded, you would not want to be making the cuts that you are, and I totally agree with that. Proper funding is something which is quite blatantly lacking. One of the things I'm sure you wouldn't want to make cuts on was the reduction of nearly £1 million in the community and care packages. At a time when we need more of our resources freed up from the additional demands in our hospitals and in our residential care services, what impact do you think this is going to have in terms of reducing the opportunities for people to live independent lives in the communities, which is less costly than actually being stuck longer or inappropriately in residential facilities, which are already with high demand? And then the bit about the mental health day service, which is being provided by the Richmond Fellowship, and the cuts that we're making. You say that you are negotiating, working with the Mental Health Trust to for them to pick up the costs so that there's no detrimental impact on the services provided. How successful do you think you're going to be in doing that? And irrespective of that, the demand and the needs appear to be increasing for mental health services, particularly with the 85% of adults that we have a duty to support. How do you think that's going to be impacting on the basis that demand in mental health is increasing, and we're talking about either asking the Mental Health Trust to fund this or making reductions in the service, which I'm sure is valued?
Thanks, Ardio. So we've got the first question, which is the £950,000 cut that we referred to earlier, about which would lead to rationing of services. And then the cut to mental health was Hardy was saying, what impact is that likely to actually, what we're actually likely to see? And then there's John's points and concerns about the parallel with children's services. You can succinctly respond to those, please, Roy. Thank you.
On the shared lives one, yes, it will have an impact, but I say it shouldn't have a detrimental impact. Shared lives will still continue, and they will still continue to support the people that are providing those shared lives. With regard to community care, yes, it will have an impact. How great an impact, I don't know at this time. It will be up to the service providers to be able to deal with that, and if necessary, then we will have to look at other ways of providing those services. But where the funding comes from, that becomes the difficulty.
Thank you, Roy, for that. Thank you for everyone's contribution to that, Roy. You've had a good session. We appreciate your frankness and your openness. Obviously, you've picked up the major concerns that are, and you'll take those on board. So we appreciate that. Moving on now to part two of the meeting, that's the capital budget. Is that going to be yourself, Jonathan?
Yeah, I mean, I'll introduce some of it for you, Chair. But not obviously it's Appendix 5 in the document as outlined in the current report. Chair, it's obviously the indicative capital programme. So obviously, by means, obviously, if this gets approved, that sets our vision out for the year. But obviously, it doesn't mean that it doesn't change as the year progresses when potential new schemes may come online. So you will obviously see from Appendix 5 that you've got subsections of the capital programme, some around schools, school repairs, then we moves on to the housing general fund, then property services, where most of the work will be around repairs and renewals, which obviously you will see various lines, budgetary lines inputted. Obviously, we do have some capital programme outlined for our parks and open spaces. In particular, on the last line there, it says Parks and Open Spaces Rolling Programme, which we want to re-emphasise the importance and the health implications of making sure that our parks are in good order to encourage people to go to our parks and increase healthy living. We also have works ongoing around the flood defence schemes, which obviously I know many of you have taken keen interest involvement. Obviously, there's a little scheme going on with the Cuttlebrook Flood Alleviation Scheme. Then moving on, we do have a Highways and Transport Programme that is obviously, and that also comes as a paper normally during the year to highlight some of the issues around replacement of vehicles, also local transport priorities, and obviously there's a big significant amount relating to the Transforming City funds, which those schemes are now currently ongoing. Then obviously we move on to vehicle plants and equipment. Again, something that we have to do each year, which are around our street pride vehicle fleets, just to make sure that they are up to date, renewed, and obviously with green credentials. And then we have one of our significant portions, which is the regeneration aspect, which obviously I know there will be some keen interests around some of the regeneration projects in our city. Chair, finally, we do have some significant items around ICT about how we're becoming a digitally enabled council. As you know, since the pandemic, we've had to move quite quickly in our operations of how we react. So we have obviously got some significant investment in our hardware developments and system developments, and including a new HR system. And then there's obviously a last line around about the provision for future investments in corporate resources, Chair. So whilst that is a relatively whistle-stop introduction of that, I'm probably more interested to know about specific lines of entries that the exec scrutiny might be keen to know about, Chair. Thank you.
Thanks very much, Jonathan. Jonathan, can we start off by you outlining to the meeting what capital projects, if any, have had to be 1, scrapped, B, delayed, or 3, scaled back? Could you outline those, please?
Well, it's not a case of that we want to stop or scrap or delay. I think being a bit subjective there in terms of that you want to make a motive political play out of it. We are in an incredibly tight situation with our capital projects. So we understand that there will be some projects that won't want to steamroll right ahead. And I know there's some keen work still going on around the Guildhall. Officers are still working on proposals around the Guildhall, and we are still keen to look at the Guildhall and get it up and running. But obviously we have had to take some really difficult decisions in that once we finalise this particular budget, that we can revisit during the year to try and make sure that we can revisit some of these ideas. So I totally accept that there might be some items in there that currently that people may be disappointed not to see, but it would also be reckless of us at the same time to continue with any projects until hopefully when cost of materials, supply, inflation does help drive down, because the nature of these schemes is very much at the base of cost price. As you know, the price of materials are going through the roof at the moment. So I don't want to commit ourselves to projects right now at the time of high costings, when hopefully in 2 to 3 years' time, when we should start to see inflation stabilise, that we can remodel projects and go forward in what would be seen as a more healthier time in financial projects.
Just before I bring Simon in, because Simon's waving furiously, wants to come in. So in terms of the Guildhall, you're indicating then that that's been delayed. Is that delayed till when, or will that never be done?
It's not saying that it will never be done. We're always going to be looking at these schemes. So it would be reckless for me to say that we're going to cancel or even not hinder it. We want to. The ambition is always to open and look at the Guildhall. However, there's some new schemes that could potentially come in play in the future that would able to help support the Guildhall in the future. But obviously, without further modelling, until we finalise this current capital project, we are going to be looking at some schemes in the near future. But I don't want to commit anything too quick to now without actually giving false hope to the public.
Are there any other biggies like the Guildhall that are not going to go ahead, or?
Well, unless there's a particular project that you're keen about, Councillor Repton, is there one in mind for you?
Well, I've invited you, Cabinet Member, to go through them.
Well, at the current moment, we've outlined everything that's been detailed there, that our current schemes are going. We're obviously continuing Beckett Well, which is something that we've been quite proud of. And obviously there is some works going around the Assembly Rooms demolition, and we'll be very looking forward to some announcements on that in the near future.
Okay, well, I've tried my best on that one. Simon?
In response to the initial question you asked about what had been scaled back, that's detailed in paragraph 4.9.11, and that is primarily by moving to a 5-year planning cycle to try and improve the profiling and delivery, which is highways and transport, flood defence and property reduced budget. The areas that got added into the capital programme on top of what was already in the approved capital programme are detailed in paragraph 4.9.19, which is an outdoor facility at Markeaton Park, a Derby football hub on the racecourse, and creating a budget for parks and open spaces, which I know lots of members have made representations about having a budget. And just to add to that, what Councillor Smale is quite rightly saying is there are a set of initiatives and projects that we'd like to bring forward to the capital programme. It was detailed in the budget report in February, including the Guildhall and other projects. But at the current time, with inflation and the supply chain being very high, it has not been incorporated in the capital programme at this time, and we've been brought forward on individual business cases at the appropriate time. So that just answers the initial question. In addition to what Councillor Smale has said. Thank you.
We heard the dulcet tones on Radio Derby today of the Right Honourable Mick Barker talking about potholes that wouldn't be filled in. That's one area we know of. We know about the Assembly Rooms. There's a big question mark about what's going to happen about that, having spent money on it, which despite advice being to the contrary not to do that.
Chairman,
So a question mark on that.
But, Chairman, correction, it wasn't Councillor Barker at all.
It was Councillor.
Sorry, Councillor Barker.
I said it wasn't Councillor Barker at all, it was Councillor Pearce. You obviously didn't hear right from Radio Derby.
Sorry, it sounded like your dulcet tone. Sorry, it was Councillor Pearce, was it? It sounded like you, Mick. Okay, thank you much. Paul?
Good evening, Jonathan. This isn't necessarily for you, but I wanted to ask a question about pressures, and we didn't get a chance. There was some spirited discussion last night when you weren't here about whether Christmas would happen in Derby this year. And it went from the breaking news to the no news category when we were assured it would happen. But another event that's going to take place that I think will be a pressure is the fact that just after we have a refreshed new council in early May, we'll have the coronation. That's a big event, and there will be some expenditure, I'm sure, involved. I was still in the womb when the last Queen, the late Queen, had her coronation. I may have leapt in the womb, as St. Luke mentions about John the Baptist. But I don't know. I'm not a particularly strong royalist, but I know it's a massive component for a lot of people's lives. What money is being set aside to look at the coronation?
If you can leave aside Paul's birthing issues, you can focus on the Christmas lights and the other points that Paul made, please. Jonathan or Simon?
As part of our strategic leadership team this morning, Alex Huff came and talked about the coronation. Currently, nationally, there's no guidance about what type of local celebrations there should be. we've been in contact with the Cathedral, who are very keen to recognise that, as if you want to call it, that civic and city act. We await to see if there's any guidance from the body that normally informs us about what is the due civic ceremonial type activity we're having. So we've started the discussion and talking to obviously our parties, the Lord Lieutenant, the Cathedral and everything else. So it's very much on our radar, Councillor Esbury. Thank you.
Thank you, Simon. Mike, then Lucy.
Thank you, Chair. Well, you talked about, what's the word I want? Improving the profile. Am I going to a longer term planning, which I completely agree with. I think that's a good idea. However, that doesn't seem to me to be borne out by the actual figures. For this coming year, we've got £177,000, and it drops to 78 for next year and 83 for the year after. So that seems to be very front-end loaded. And I'll just pick out two items. School, it goes from 30.6 to 6.5. Are you sure we're going to spend all that sort of money in this coming year? Highways and transport goes from 49 to 7. Thank you, Chair.
Thank you, Mike. Jonathan?
I can go on some of those in particular. Obviously, there's some big schemes that are already in the project, and I get where you're coming from, Councillor Carr. But obviously, the Transforming Cities Fund is obviously one of the biggest proponents of the highways and transport schemes. Obviously, we've got the bus and rapid transit links, which I know the works are going on ongoing. So I understand the concerns around, are we going to be able to utilise these budgets in what we're proposing? But of course, we will minimise any slippages in any of the projects. That's obviously always our intention. But some of the other schemes, Simon may be able to give you some specifics on. But as you can see, that any of the ones that are detailed in with significant amounts of money are, like you've highlighted about schools, with the SEND expansion or SEND provision. So obviously there's schemes going around that. I don't know if Simon's got any further just to add on some of those project schemes that are coming forward this year, turning online.
Thank you, Jonathan. Simon?
Yeah, just for clarity, and the appendices do show this, you'll be aware that members approved additions to the capital programme for SEND provision in respect of especially St Clair's and the remodelling of St Clair's, hence why there's a significant proportion in 23-24. The portfolio holder has quite rightly talked about highways and transport being the TCF, Transforming Cities programme, that has an end date. The parks and open spaces is primarily about park life. That's the Football Association development on the racecourse, which makes up a significant portion of the 12 million. And regeneration includes projects like the Beckerwell Performance Venue, which hopefully will start building around Easter of this year for completion in sort of 24-25. So when we talk about reprofiling, Councillor Carr, we were talking more about the main programmes of, say, highways investment that we make every year, property investment, and other annual cycles. What we want to try and do is to get away from people have to wait until the budget is approved each year before they do the design work, which means then maybe work commences the second half of the year, doesn't get spend slip. We want to try and get better at matching activity and the spend profile. So hopefully that gives a bit of explanation in addition to what Councillor Smale has said. Thank you.
Thank you, Simon, for trying to emphasise the positive, as ever. It's a good job because there's not a lot to crow about these days, I'm afraid. Mike wanted to quickly come back, then I'm going to bring Lucy in.
Yeah, I completely support what Simon's saying about the reprofiling, but the slippage, I remember I used to be cabinet member for this, it always happens. And this doesn't, I don't think, take any account of it. The schools ones are massive. The county council are building a new school near me, very close to where I live now. It's 2 years late. So I will be interested to see if we actually achieve this spend profile. Thank you, Chair.
Lucy?
Thanks, Chair. Jonathan, within this, there are some things which are very specific, such as additional funding for LEDs and street lighting, which I understand, and it will have a payback and will be good, and the insulation that's going into our housing stock. But there are also some very non-specific things that say things like energy projects, and there's just under £1 million of that over the 3 years. And there was another one as well, which is also fairly non-specific in terms which looks as though it's energy. Can you say anything more about what they consist of and what the purposes are, and whether they are likely to have a positive payback in a given time?
Could you just point me to the line, Lucy? I'm just looking.
Page 48, about halfway down.
Page 48. Okay, Jonathan or Simon to respond, please.
No, the 2 points.
Oh, sorry, Lucy, okay.
The second one is a principle, which, you know, I've said that some of these energy projects may well have a return on investment. If projects during the year come forward which are likely to have, or before we agree this budget, that are likely to have a return on investment that can be therefore funded through from the Public Works Loan Board, what's the current administration's attitude going to be adding such things into the capital programme?
Thank you, Lucy. Jonathan or Simon? You're both looking at each other. It's double act. Simon first part, and then your able assistant, Jonathan.
Yeah, obviously the second part was the administration's appetite, so I'll leave that to the portfolio holder, as I should. In terms of energy schemes, the line that you've highlighted, we have many operational assets, some that have had investments in energy efficiency through SALEX funding and our own funding, some that could benefit from that. We always look at this in respect of, can we deliver better energy efficiency, and obviously part of our move towards the outcome of climate emergency that we've set ourselves. And this is a recurring budget to allow us to, for example, invest in energy efficiency measures. That might be simple things from lighting to, as we have to replace components and buildings, can we get a more energy efficient, whether that be boilers, windows, anything else. So it's a recurrent programme. In terms of the mechanics of, if a scheme is identified that has a return on investment, we obviously have well-tried investment appraisals, and there are delegations and flexibilities for us to bring projects through the quarterly monitoring for consideration and to reprofile between financial years. I think Councillor Kerr will remember that she brought, for example, a programme that could be delivered by Roads Connect in respect of LED street lights, which has saved money, which has borne fruit, obviously, in the recent energy crisis. We've also got the hydroelectric on the river, and we will always consider those, because one of the council's policy intents is around reducing carbon emissions. So there are mechanisms to do it, but it will be based on business cases rather than placeholders, apart from the recurring budget that we have. Thank you.
Thank you, Simon. Jonathan?
Just to, come on the last point on the political side that Councillor Kerr was asking for. Obviously, as an administration, our appetite is always to look towards whatever scheme projects that we do that helps become, either be energy efficient, carbon neutral, anything that we can do to help protect our environment. But I know we've also, Chair, not to deviate, but we are obviously got a motion surrounding some of this tomorrow evening, which I know myself and other colleagues will be picking up some of the issues around that motion. But I will say this, Chair, we won't be railroaded into any schemes that we don't deem as unsustainable or negative towards our budgets. Obviously, we will always want to do our best to protect the environment, and as a council, we want to be seen as leading the way. But we're also only 2% of that, so of the pollution that we cause to the city. So whilst we will, of course, lead the way, but I will reiterate that I don't feel comfortable as an administration to be railroaded or bullied into doing schemes that will be a detriment to the taxpayer in the long run. But we'll, of course, always do and look at schemes that will be of benefit to everyone and members in this chamber. Thank you, Chair.
Thank you. I've got a final, I've got two final comments, and then I'm going to sum up about the two meetings as far as executive scrutiny are concerned. And so that's going to be Paul and Danielle. Paul.
Thank you, Jonathan, about energy issues. On page 48, it talks about Kedleston Road's heating system and various boiler replacement. They both together cumulatively amount to about three and a quarter million by the end of that, the MTFP. Are we looking at putting in underground heat pumps if the geology is conducive, as that would be a long-term saving, maybe a high initial input, and they might have to change the arrangements how that building is heated internally, but it actually would be something that would be there for a long period of time, and long after the advised period where boilers shouldn't be being used if possible. Certainly gas and oil-fired boilers.
Thank you, Paul.
Of course. I mean, it raises some good points around heating systems. We've come a long way in particular, the last 5 years alone. So whatever schemes that are available that can help deliver a heating system, either at Kedleston Road or the various boiler replacements that we have across assets in our portfolio, then we'll look at them. So we'll be happy to take on those points that you've just raised about underground heating, pump heating. By all means, we will have those conversations with property, because I think there is some exciting times ahead in terms of using that form of heating. So we'll take those points away from you, Paul, and raise them up with properties and see how that develops.
Thank you, Jonathan. And Danielle for the final question. Danielle.
Thank you. Now, I know you asked for some ideas, so I've got some ideas. But first of all, it's great to see that capital funding is going in to expanding existing provision in Send. What I do ask, isn't this more of the same? And I'd like to know, are there any plans to put capital funding into funding local specialist provision that children and young people are increasingly going out of area for? Thank you.
Thank you. Thank you, Danielle. Jonathan?
I can't comment on an individual thing like this, but I think from what I'm hearing, that this will be the case moving forward, but we'll be taking on individual cases. So whilst it might not be written in this line at the moment, but I believe from conversations from Councillor Williams, this will be happening in the future. So when those kind of schemes come forward to support our Send children, but by all means, as Councillor Williams has always said historically, that any ideas coming forward to support schemes moving in Send provision, obviously we'll always take them on board.
Nicola?
It's not very political, Chair, but just looking at page 46, and just in response to Danielle's point, it's a point keen to my heart. Although, obviously, I do feel that we do need to try and keep kids in mainstream school where possible. My children themselves do attend a specialist provision school, but on page 46 there is a line in there that says Send provision schools, and I think there's 12.5 million and 4.5 million for the following budget draft proposals. So I do think that there is that. I just wanted to point that out for clarity, Chair.
Thank you, Nicola. Simon, final comment. Just to highlight, and the Cabinet received, I think in December, the report on bringing forward the Send Capital Programme, that there'd already been investment in Kingsmead and Ivy House. There was the proposal for St Clair's, which was phase 1B, and I know you're aware of this, Councillor Lind. And in that report, it talked about the totality of funding available, which was council money, and also 2-yearly allocation from the government towards Send capital provision. So, as Councillor Ralston has said, there is still an amount left in there in terms of future provision. That future provision may be infrastructure, buildings, but also that report talked about different service models, and I think it was effectively a special school and mainstream support proposal as part of that report. But there is capital money left to bring further developments forward, and that report highlighted the roadmap for it. Thank you.
Thank you, Simon. Thank you for the participation. Do we know how much?
We'll get that back to you because I'd probably have to take A minus B and I don't have A and B with me.
Thank you very much for everybody participating in these two important, lengthy and absolutely necessary budget meetings. Lots of points have been made, and I think right across all the parties there is concern about the situation that we're in. I've been a councillor since 1987, 44 years almost, and this is the worst financial situation I think this city faces that I've ever experienced in my life. We know the causes for this. Some are external, but a lot are internal. There are sadly not a lot of places we can go, but I'm going to make a recommendation from Executive Scrutiny this evening that hopefully cross-party you'll support. It may be forlorn, but I think it's beholden on us nevertheless to actually make, and this is what I suggest. In light of these unacceptable cuts and service reductions that will badly impact and affect the lives of many thousands of people here in Derby, Executive Scrutiny requests that Cabinet to again urgently ask for a cross-party meeting with relevant government ministers to get a more favourable financial settlement or help. Do I have a seconder for that, please? Hardiel. Are you quite happy to vote on that? Those in favour, please show. Those against, please show. Okay. Thank you very much. Thank you very much for your attendance. Thank you, officers. Thank you, Cabinet members as well.